Hi, my name is Kiru, and today I will be talking about how social workers can end violence against rural, remote, and northern women. The purpose of this presentation is to talk about how to provide intersectional, trauma-informed social work interventions to rural, remote, and northern women who experience interpersonal violence. According to Statistics Canada, rural, remote, and northern women experience higher rates of violence than women living in urban cities. Rural, remote, and northern women are 3 times more likely to experience violence than their urban counterparts. Before we talk more about the dynamics around domestic violence or interpersonal violence for rural, remote, and northern women, it's important to talk about key definitions. When I say rural, I'm talking about a geographical location with less than 10,000 people in their community. When I say remote, I refer to a community that is not accessible by road year-round because of its geographic location. When I say northern, I'm talking about a community that the provincial government has deemed as being part of a northern part of a province. The Canadian territories are also considered northern parts of Canada. Some important stats. The highest rates of domestic violence and homicides in rural, remote, and northern communities are reported in the Yukon, Northwest Territories, and Nunavut. Indigenous women, children, and girls experience the highest rates of violence in rural, remote, and northern areas, and this includes in in places such as the territories of Canada. Rural, remote, and northern women report a higher number of protection order violations than women in urban areas. In 2010, more than half of the women in New Brunswick died by firearm use. If you compare this to stats to women in Ontario, in that year, 14% of women died by gunfire in Ontario. Similarly, in 2010, 75% of women died at the hands of a man who abused alcohol in rural and remote areas, while in Ontario, 42% of women died by a man who abused alcohol. In New Brunswick in 2010, 66% of rural, remote, and northern women died because they stayed in domestic violence situation. In contrast, 81% of homicides in Ontario were because most survivors left abusive situation. So these statistics show that there are very clear differences between rural, remote, and northern women and women in urban centers and the reasons for why they experience violence. So, what are the risk factors that lead to violence against rural, remote, and northern women? So, there's geographical location and isolation that leads many women to have a risk of violence in rural, remote, and northern communities. Rural perpetrators have specific dynamics that contribute to why rural, remote, and northern women experience violence. There's also barriers to service. So, rural, remote, and northern women find it harder to get access to support to leave their violent situations. There's also cultural barriers that prevent rural, remote, and northern women from leaving violent situations. Finally, poverty and poor mental health and physical health also leave rural, remote, and northern women at risk of higher rates of violence. So, in terms of looking at, I'm going to talk now about each specific reason to why rural, remote, and northern women experience violence. And first, I'm going to start with geographical location isolation. So, the geographic location of rural, remote, and northern areas contributes to the isolation and the increased victimization of rural, remote, and northern women. So, there's for instance, large swaths of distance between neighbors and emergency services leads to isolation of these women. So they're isolated from extended community and emergency services, and that allows perpetrators to control and have power over these rural, remote, and northern women. They also have barriers for transportation, so they can't immediately leave their homes or jump on a bus or a train to get somewhere safe. Often they have to travel long distance to escape abuse. Poor rural, remote, and northern women don't have access to cars or money to take a bus if they do get if they are able to travel to catch a bus. Even when they have to access to transportation, they have to travel alone in long distances to get to support services. Often, rural, remote, and northern women must travel 3 times farther than urban women to access support services. So 25% of rural and remote and northern women have difficulty traveling versus 1% of urban women. Rural, remote, and northern women often travel more than 40 miles to access support services. Public transportation is also not a viable solution for half of the rural, remote, and northern women in Canada. Another risk factor is the rural perpetrators themselves. So, rural, remote, and northern women are at risk of higher violence because rural, remote, and northern perpetrators of violence often engage in more severe and chronic forms of violence against rural, remote, and northern women. So, researchers have found that remote, and northern men have higher rates of substance abuse and unemployment. The lack of employment is due to the lack of education and the prevalence of low income, precarious jobs in rural, remote, and northern areas. Often, these perpetrators take out their personal frustrations on their partners or the women in their lives. The lack of support services for men contributes to higher rates of violence against rural, remote, and northern women. So, we're talking about here there needs to be more equitable jobs. The poverty rate needs to be cut in these areas. Men need more access to education and emotional regulation. Also, male perpetrators in rural, remote, and northern areas have access to guns, which heighten the risk of violence and death for survivors. So, guns are seen as culturally acceptable in these communities. They're tools for protection and hunting in rural, remote, and northern areas, and men often have a gun with them at all times. But the propensity of guns in these areas also has contributed to less disclosure of violence by women in rural, remote, and northern areas. They fear death by gunshot, and therefore they are less likely to report to neighbors, loved ones, or support services about the intimate violence that they're experiencing in their homes. Often they feel if they leave their partner, that their partner will find them and kill them with the gun before they can truly escape. And these fears are not unfounded. Statistics show that between 2002 and 2010, 27% of women died in domestic violence situations because of the use of a firearm in Canada. Rural, remote, and northern men are 2 times more likely to have access to a firearm than urban counterparts, and rural and remote northern men are 2.5 times more likely to use a firearm to kill their partner than their urban counterparts. Also, 1 in 3 domestic homicides in rural and remote northern areas are due to the use of firearms. Another risk factor is the barriers to service. So, rural, remote, and northern women who are at risk of heightened violence are lack services such as shelters. There's no accessible police services. There's no accessible court systems, and traditionally, these are the support systems that would support survivors in urban areas. Rural, remote, and northern women do not have accessible support services in their communities, but they also lack technology such as telephones and computers, which would allow them to learn about which services are available to them or their rights in relation to the violence that they're experiencing in their homes. If you don't have access to technology, then you would not have the skills to use technology and to keep yourself safe from violence as well. All of these barriers constrain a woman in the domestic violence situation and in rural, remote, and northern areas. Cultural barriers. So, rural, remote, and northern women face unique cultural barriers that keep them stuck in violent situations. Research points to rural, remote, and northern cultural ideas such as the permanence of violence, religious roles of women, the importance of privacy in these communities, and the supremacy of patriarchal values that place men as the owners of women in these communities. All these factors contribute to the context of violence against rural, remote, and northern women. So, rural, remote, and northern areas are often composed of deeply religious communities. These communities ask for protection of marital bonds and view men as the breadwinners and the protectors of the family. Women, in contrast, are seen as homemakers and are expected to respect the patriarchal role of her husband in her family and her community. Any deviation from these cultural or religious values can leave a woman feeling isolated from other community members. So it's important that that we understand that these values in rural and remote areas sometimes suffocate women and prevent them from leaving domestic violence situations. It also constrains women from disclosing violence to loved ones or support services. In fact, talking about domestic violence in these areas is often stigmatized because these communities are small and scattered, with scattered homes in specific regions. These communities often everyone knows everyone, and when you talk to someone, there's always a fear of shame or the breaking of confidentiality. Um, so women are often afraid to disclose violence because they're afraid that social service workers and emergency workers can be neighbors or friends of the abuser. All of these situations constrains us, rural, remote, and northern women from disclosing abuse at home. Um, the next barrier is the poverty, poor mental health, and physical health of rural, remote, and northern women. So poverty, mental health, and physical health of rural, remote, and northern women is very important when we look at how to end domestic violence and or intimate partner violence in these areas. Often, rural, remote, and northern women experience poor psychosocial and physical health outcomes compared to their urban counterparts. This is mostly attributed to high rates of poverty in their community. They have, again, higher rates of poverty, higher rates of unemployment, and a lack of affordable housing. These factors make rural, remote, and northern women remain with their abusers because it's the only way they know how to provide for their children and survive. The inability to support themselves or their dependence on their abusers contributes to poor mental and poor physical health for these survivors in these rural, remote, and northern settings. Poor social support and the trauma of violence compounds to impact rural and remote and northern women's health in severely detrimental ways. If they cannot access appropriate medical services for the physical and sexual violence they endure, then they are traumatized and are at a higher risk of death. Finally, the risk of violence for Indigenous populations in rural, remote communities. Okay, so rural, remote, and northern women often experience different intersecting risks based on their race, class position, ethnicity, and other socioeconomic reasons. Indigenous women in rural, remote, and northern communities experience higher rates of abuse because of their social location. In rural, remote, and northern communities, Indigenous women and girls are often susceptible to ongoing colonial violence via the state, but also local violence from local populations, specifically white populations. So in these communities, resource extraction such as mining, oil, and gas extraction, as well as hydroelectric development, contributes to the prevalence of man camps. These camps are of male workers who live and reside in rural, remote, and northern areas, and they often live there because they're employed to work for resource extraction companies. The men in these camps often harbor violent and racist ideas about Indigenous peoples, um, and women in the community. They are also men that These men are also people that struggle with drugs or alcohol abuse. When you put all of these factors together, um, when men from these camps have breaks or go into the community, often they perpetrate violence against Indigenous women and sometimes even kill them. The high rate of violence for Indigenous women in these settings is exacerbated by the limited social services available to them to address these risks of violence in these communities. So, not a lot of people talk about these man camps and what happens in these communities, but it's important for social workers to understand the dynamics of rural, remote, northern communities, especially Indigenous populations, and what they endure in these communities. So, best practices. So, there's a lot of good practices that social workers can use to support rural, remote, and northern women who experience violence. So, interagency collaboration is one way to help assess and mitigate the risk of violence for rural, remote, and northern women. So, social workers can share info, consult with one another, share resources between the police and victim services and community services in rural, remote areas. They can also help build the level of trust between the service provider and survivors in rural and remote areas. With trust, when there's trust, survivors are more likely to share essential information needed for their safety, and you can work together with service providers to help support the survivor. Interagency collaboration also allows for efficiency and a short turnaround time when you're trying to respond to a survivor's pleas for support. Social workers can also increase training and education around the nature of violence that rural, remote, and northern women face. So it's important to have training and education about the nature of violence in rural, remote, and northern areas. This training should also be provided to service providers, community services, the police, and community members that um, make up the communities in rural and remote and northern areas. So this training should include education about healthy relationships, boundaries, and conflict resolution. Survivors should also be given education about their legal rights in relation to marriage and families. Survivors should know what the next steps should be if they decide to call the police or end an abusive marriage. Service providers should also have a comprehensive and nuanced understandings of the dynamics of rural, remote, and northern communities, indigenous communities, and the legacy of residential schools in rural, remote, and northern areas. It's also important to educate young people in rural, remote, and northern areas about healthy relationships, consent, and healthy families. Finally, outreach programs are helpful as well in mitigating the violence against rural, remote, and northern women. So, the creation of outreach programs is considered promising and a proactive way to support rural, remote, and northern survivors. So, outreach programs can decrease the geographic and social isolation of these women. Service providers can periodically go into these communities and provide information about their services. Their presence will allow survivors to not only learn about their rights, but also gives them opportunities to get access to transportation or learn about services when these social workers or service providers come to their communities. Um, so often outreach programs that have been successful in reaching rural and remote northern women give these women access to technology. So they give them burner phones or give them websites that they can access so they can flee in a violent situation. Often these outreach programs meet secretly in coffee houses, church basements, or in public health buildings. So rural, remote, and northern women who do experience violence can meet them in safe spaces. It's important that women are given the opportunity to leave their homes without the fear of being abused. So it's always important to keep these outreach programs confidential if they do happen, and confidential in terms of who attends, what the programming is, and where the location is. But all of these best practices are some ways that social workers can look to support rural, remote, and northern women who experience violence. That is the end of my presentation. Thank you so much. And references.